The idea is it's supposed to be comfortable, safe, a place where you can feel secure and you can have a private conversation, which sometimes isn't easy in a busy pharmacy.
Yes.
Right? So now you have that option. Do things like A1C tests and lipid tests. Now, an A1C test is like a sugar test, the same one that your doctor would give you. And normally you'd go get a lab requisition and go to the doctor to get the test. Here, we can do the test for you in about 20 minutes and you get the same quality of test results. So you can actually manage your diabetes better because you can monitor yourself and take autonomy over that. The vision that we all have in our pharmacy, Shoppers Drug Mart, myself, is we want care to be accessible. We want it to feel within reach, and we want people to have the ability to take care of themselves.
Hey everyone, exciting times in healthcare. Shoppers Drug Mart has its very own pharmacy care clinic, and I'm at the Newton location to tell me all about it. I'm joined with Sukhvir Seehra. He's a pharmacist and an owner. Let's say hello to him. Hi, how are you?
Oh, great. How are you?
I'm doing fantastic. So tell me all about this.
So we have built a pharmacy care clinic right behind me. It's a little bit different than what you've normally seen in the pharmacy. Usually we have a dispensary, but in this case, we've got people staffed to assess you for just minor ailments.
Mm-hmm.
So things like minor skin rashes, or if you've got stomach acid, birth control, urinary tract infections, canker sores, cold sores, hemorrhoids, muscle pain. These are things that normally you would have to go see the doctor for, but they're fairly minor in nature. And now you can come pretty much anytime to see the pharmacist, and within 10 to 15 minutes, sit down in a private room, get a consultation, get an assessment, and then get a prescription medication to help you with the issue.
With that said, when patients come here, what do they need to bring with them?
People just need to bring their care card. And then you come by. The first thing you do is you go into the check-in station. You'll meet somebody that we call the healthcare concierge. And they're a person that's there to help you understand the process, get you prepared to see the pharmacist, get some initial information, and then you just wait on the side in our sitting area for about 5 or 10 minutes, and then you get to go see the pharmacist. So there's not much required for you to come here.
And how is this different from a regular pharmacy visit?
When you go see the pharmacy, you've already seen the prescriber and you're coming to get the medication. Here, you can actually see the prescriber at the pharmacy and then get your medication right after. So it's a bit more convenient in that sense that everything is in one place. And the idea is to make the care much more accessible. Right now, I think the biggest challenge we're having in healthcare is getting to care in a timely manner.
Right. So with that said, do people need a referral or an appointment? How does that work?
No, so the clinic is designed for minor ailments, which are, there's about 20 disease states that we can treat for, and you don't need a referral. You can actually come to the pharmacy, you'll see the pharmacist, they'll assess you, and if there is a need to refer you to another healthcare practitioner, they will. But if they can give you something in that moment, that's what the goal is to help you right there and then.
You mentioned care concierge. What are some other particular treatments or services that you offer, whether it's accessible childcare spaces? Like, what exactly is going on?
So we've actually created, I love to show you these beautiful rooms we made. And they've got little things like little TVs to keep kids a bit distracted. For example, if they're getting a vaccine, little lighting changes to set the mood so that people can feel a bit more calm if the lights are too bright. The idea is it's supposed to be comfortable, safe, a place where you can feel secure and you can have a private conversation, which sometimes isn't easy in a busy pharmacy.
Yes.
Right? So now you have that option. At the same time, we've also got things like medical grade equipment, like beds and blood pressure monitoring machines. And we can do things like A1C tests and lipid tests. Now, an A1C test is like a sugar test, the same one that your doctor would give you. And normally you'd go get a lab requisition and go to the doctor to get the test. Here, we can do the test for you in about 20 minutes and you get the same quality of test results. So you can actually manage your diabetes better because you can monitor yourself and take autonomy over that.
Great. I would love for you to show me the incredible space that you've got.
Yeah, please come this way.
Okay.
I've already something on that.
Oh, very nice. I already feel like I'm in a very sophisticated walk-in clinic room. I think this is great.
That's exactly what we're going for. We want you to feel that professional environment so that you're in good hands. There's little things like this. This is the TV screen I mentioned. Kids all playing with this and finding the little things while they're waiting. These are the machines that we use to do those tests. With that machine there, we can do your sugar test, your cholesterol test. And with the other machine, we can do things like a strep test. We've got vaccinations, so the pharmacist can give you your COVID vaccine or flu vaccine. A lot of times, construction workers, for example, they get a cut and they need a tetanus shot. They come here and we can give them a tetanus shot.
Great.
And then there's the travel vaccination. So if you're going to India or Mexico for a vacation and you need your travel shots, you can come here and get those also.
Fantastic. Now, what does this mean for the community, this particular initiative?
The idea and even the vision that we all have in our pharmacy, Shoppers Drug Mart, myself, is we want care to be accessible. We want it to feel within reach, and we want people to have the ability to take care of themselves. Sometimes everybody's busy with life things, paying the mortgage, taking care of the kids, and you get a rash, but you don't get around to seeing somebody because it's hard. And then the rash sometimes, can get worse and sometimes infected. And it just seems very preventable, and it also leads to unnecessary suffering. Right. So I think at the end of the core of it is there's these little things in life that I just feel like we can take care of and we've got the resources. They've just never been at this capacity before with this way for the community. And I think that's what gives us the most pride, is being able to help people before. Sometimes in healthcare, you almost wait for people to get sick before you can do something. Right. It's much more powerful to get there before that.
Now, what I find great and I think is already a success with this particular model with the pharmacy care clinics is that you've got 4 in operation. So this is the one at Newton. Tell me about the other locations. Where are they?
So there's one at Newton. My other location is on Panorama at 152. And then there's 2 other locations that have opened up. One is on 96 and 128 in Cedar Hills. And then there's another one in Guildford.
Great.
And then 3 others. So we're going to have a total of 7 by the end of this year.
Wow. So this is huge for the city of Surrey. Speaking of that, what's been the support from the city of Surrey and Mayor Brenda Locke?
Oh, Mayor Locke has been super supportive. She's come by to visit us. He's met the teams. She's really been behind this initiative to make sure that the residents of Surrey have every possible opportunity to get care.
What sort of things have people come in terms of being treated for?
Well, it depends on the season. So this season, it's a lot of allergies. Like we're getting a huge amount of people for allergies and eczema, rashes, mosquito bites. So we're doing that as our main treatment right now. But then throughout the year, we'll do like things like UTIs or like acid reflux. Those things will be throughout the year.
And what's been the response of the public?
People love it. They get care within like 15, 20 minutes versus having to go to like the emergency or the doctor. And they love how fast they can get care. And then they feel like they're being acknowledged a lot faster. People have slowly learned about more, but this clinic is finally like getting like a boom of people understanding that they can get these things done here.
Great. What's a message you'd like to share with the community?
I'd just like for everybody to know that, we're open 10 to 6 every single day for the pharmacy care clinic. And the pharmacy is open 8 a.m. to midnight. And where you don't need an appointment, you can walk right in, go right to the healthcare concierge, let them know what the challenges that you're facing, and we'll help you find a solution.
Okay, great. And if they wanted more information, is there a website that they can go to?
You go to shoppersdrugmart.ca, but the best way is just give us a call or come see us at the store.
Okay, great. Thank you for taking the time, and thank you for sharing all that valuable information.
Thanks so much.